And now when we come to the other layers of the foot, we have the second layer and fourth layer. And in the second and fourth, we have two muscles, two tendons. How can we memorize them? They are very easy. First of all, think about only one thing, and that thing will take you to the others. What is that thing? It's the flexor digitorum longus, you guys. The tendon of flexor digitorum longus is gonna be the first tendon we have here. And remember the idea I told you previously in the upper limb, which is that the lumbricals, they are muscles that take their origin from the tendon of the flexor digitorum longus. So this is the muscle, the first muscle we have. Another thing, we have a muscle that is called quadratus planti or plantae. This muscle comes out of the calcaneus and it is inserted into the tendon of flexor digitorum longus. So this tendon and a muscle that goes to it and a muscle that arises from it. So now we have two muscles related to this tendon. And the last tendon we have is definitely going to be what? Remember, we had flexor digitorum longus and we had the flexor hallucis longus, because we always know that this big boss has its own muscle. So because I have the flexor digitorum longus going to all the digits, I have one for the hallux. So by this, everyone knows the second layer. It's a tendon, muscle going to it, muscles going out of it, and the tendon to complete those tendons. This is all we have here. So two tendons, tendon for flexor digitorum longus, tendon for flexor hallucis longus, the quadratus plantae, and the lumbricals. This way I can remember two muscles and two tendons. Now what about the fourth layer? This is the easiest layer, because remember guys, fourth layer means that you are reaching the bone. So the muscles between the bones are the muscles that we call them the interossei. So I have dorsal and plantar interossei. The dorsal are doing abduction, the plantar are doing adduction, so you can remember the function from the upper limb. And what would be the two tendons? Remember the two most important guys ever we have in the lower limbs, which are the tendon of fibularis longus and the tendon of tibialis posterior, because those guys, they are very important, you know, for the support of the arches. All right, and they are the deep most ones, and they are going to be in your fourth layer definitely. Okay, so this way you remember that we have two muscles, two tendons. So with that, you understand everything. Why did I bring the hand in this picture? Because I want you to just remember the function of the lumbricals. Because you guys know that the palmar interossei, they do adduction, the dorsal interossei, they do abduction, and we talked about that very nicely and extensively in the upper limb. I don't want to talk about this more in here. I just want to remind you that the lumbricals, what do they basically do? They put your hand in the correct position, they put your hand in the writing position, which is the flexion of the metacarpophalangeal joint and extension of interphalangeal joint. So if that is true, in the upper limb, it's the same thing is going to happen for lower limb. All right, so the lumbricals here are going to do also the same flexion of metatarsophalangeal joint and extension of interphalangeal joints. So this is just to remind you that the general rule of the lumbrical, you can just apply it here and you all set with the information of function of your foot. All right. And we talked about the fourth layer, and we understand the idea of dorsal and plantar interossei. You can go ahead and watch it in the hand. You will find the same concept is true here regarding how do they look like and why do we have only 3 here and why do we have only 4. Go ahead and watch the hand and you will understand everything about the interossei. It's just the same concept. Now coming to the blood supply. Now guys, remember when we talked about the blood supply of the lower limb, we said that we have in the artery that was coming, which is the femoral artery, which was coming in the adductor canal, and it showed up in the popliteal region as popliteal artery. And the popliteal artery, when it came down, it gave one artery that goes anteriorly, and that is what we call the anterior tibial artery, and another trunk here that gave me posterior tibial and fibular, right? And that was the tibiofibular trunk. I had here fibular posteriorly, and I had here posterior tibial artery, and here where we stopped our talk in the leg. Now let's go ahead and see what happens to the anterior tibial anteriorly, what happens to the posterior tibial, and what happens to the fibular artery. Most important arteries that supply the foot is the anterior tibial and posterior tibial, all right? Now what happens is, as the anterior tibial comes down in the anterior aspect of the leg, it goes all the way to the foot, and once it comes below the extensor retinaculum, we call it dorsalis pedis. Why do we call it as such? Pedis means foot in Latin, and dorsalis means dorsal aspect. So this is the artery that is responsible for the dorsal aspect of the foot. So as the dorsalis pedis comes down here, it's gonna give you, and first of all, it's going to give you the malleolar branches. It's going to give you medial and lateral malleolar branches, and it goes down and give you tarsal branches, gives you medial and lateral tarsals. And then it comes down, it's going to give you an arcuate arch, arcuate artery, and this is going to replace the idea of having, remember guys, your hand, the superficial palmar arch and deep palmar arch. We don't have that here. The superficial arch is going to be your arcuate branch of the dorsalis pedis, all right? That arch is going to be superficial. What does superficial mean? It means that it comes in the dorsal aspect, in front of the bones, on top of the bones, in the dorsal aspect of my foot. This is the one in front of the, I liked actually this diagram because it gives you an impression about the arcuate artery branch of the dorsalis pedis, all right? And it gives you an idea that the deep plantar arch is actually the deep arch that goes in the plantar aspect of your foot, which is coming actually from the posterior tibial, which is actually coming from the lateral plantar. Okay, so let's go ahead and see what happens anteriorly, and then we will see what happens posterior. This is very simple and basic. So we have that dorsalis pedis, gives you malleolar, gives you tarsals, it gives you an arcuate, and that arcuate will give you small branches to all lateral toes. The most important one will go all the way here in the space between the first and second metatarsals, and it goes all the way here deep here. And once we come in the first interosseous space, it will give you a deep branch here that's going to penetrate down here, because that branch actually is trying to complete the arch that is coming from the lateral plantar artery. Because you guys remember that we need to have connections with those guys, all right? So here, the deep plantar branch is going to go all the way and here, can you guys see in the first interosseous space, you guys can see that the dorsalis pedis will give you a branch that goes deep down in the plantar aspect here, and that is going to complete the arch that is made by the lateral plantar artery. All right, so this is the whole story about the anterior tibial. So anterior tibial artery comes down here. Once it exceeds the extensor retinaculum, it's called dorsalis pedis. It goes to the medial aspect. It gives you arcuate, and that arcuate gives you small branches to the lateral toes. But the main blood supply is actually from the lateral plantar artery, and I'm going to show you one nice picture about that. And then it gives you a small branch deep. It penetrates deep down there to complete the arch that is made by the posterior guys. Right now, as you look at the posterior aspect, you guys remember we had the popliteal artery, and then we came down here, we had the posterior tibial, all right, the posterior tibial, that was a common trunk, and then here we have the posterior tibial, and we had the fibular. The posterior tibial goes all the way down, it goes down all the way, and as we reach the foot, you're going to have an arch, and that is what we call the deep plantar arch. So this is going to be by the lateral plantar artery. So the posterior tibial, once it comes down to the flexor retinaculum, it needs to give you lateral and medial plantar. The medial goes to the medial aspect. It's not a huge important branch. The most important branch is the lateral plantar, and this is going to give you the main blood supply to the lateral toes. So the main blood supply here is actually, and the digital branches of the lateral plantar are the main blood supply to those guys. And the main blood supply of the hallux is going to be the dorsalis pedis, all right? And then you will have a deep branch that was coming, remember the deep branch that was coming from the dorsalis dorsalis pedis, as it was ending anteriorly, is going to close off the arch that was made by the lateral plantar artery, which is actually a branch of the posterior tibial artery. All right. How can we palpate for the blood vessels, which is a very important concept in anatomy? Just think about it. Like, you know that the anterior tibial is coming all the way down, and as it comes down to the extensor retinaculum, we call it dorsalis pedis. So if I want to palpate for the dorsalis pedis, it's going to be in front of the foot. Where exactly? This is going to be lateral to the tendon of extensor hallucis longus. So if your extensor hallucis longus is going to the hallux, you need to put your finger lateral to it here, so you can palpate for the dorsalis pedis. Now, what about the peroneal? Peroneal is going to be definitely here on the lateral aspect of my foot near the fibula. So if this is my fibula, I need to go in front of the lateral malleolus, so I can feel for the peroneal or fibular artery. Now, what about the posterior tibial? You guys know that posterior tibial is coming from the backside. So as it comes from the backside, and remember when we came down to the flexor retinaculum, we bifurcated into medial and lateral plantar arches. So in order to palpate for this, I need to palpate it near to a tendon or a bone. My reference is going to be my medial malleolus. So just make sure that if you want to write it down on your foot for a couple of days, you just watch it. Whatever kind of memorization kind of method you want to follow, just make sure you palpate it on your hand. If you want to just write it down on your foot and see it for a couple of days, 3, 4, 5, 7 times, you will be able to remember it later on. This is your surface markings that will help you to remember where to palpate for the arteries of the foot. And this is a nice a diagram that I saw. I got it from the researchgate.com. It's just to show you that you guys know if you are in the plantar aspect of your foot, definitely laterally you have the lateral plantar artery, medially you have the medial plantar artery, and remember the domination of the blood supply of your toes is going to be the bilateral plantar artery, although there is contribution from the arcuate branch of the dorsalis pedis. And remember that in the hallux you have a mixed blood supply of all guys, and then in the dorsal aspect of your foot, the domination of the blood supply is going to be by the dorsalis pedis. And then you will also have, remember the lateral aspect when we were palpating near to the fibula down here, this is the fibular artery. And then you have here calcaneal branch. So blood supply of your heel is going to be by the branch of posterior tibial artery, which are calcaneal branches. All right, this way you can remember the blood supply of the foot. Now, what about the innervation? It's very simple and easy. Remember, you guys, we had the sciatic nerve, and then the sciatic nerve came down. It gave you the common fibular laterally in the popliteal region, and it gave you the tibial that went straight down here up until all the way until we reach the same point where here, once we reach the foot, it gave you medial and lateral plantar nerves. And I want you just to remember one thing: the vessels are lateral to the nerves. Not lateral. The vessels are medial to the medial and lateral to the lateral. Another word you can say, they are outside. So the relation between the medial and lateral plantar nerves and arteries is that vessels are outside, or the vessel is medial to the medial and lateral to the lateral, right? And then you can go with the distribution to give you all the digital branches. So you have medial and lateral plantar nerves. They're coming from the tibial nerve. All right, so nerves of the foot were coming from the definitely the tibial nerve, because you remember what happened to the common fibular. We actually had the deep fibular in the anterior aspect, and then we had the superficial fibular to the lateral aspect. They were taking care of guys there. I just want to give you something that I forgot to mention, which is the innervation of your foot. Innervation of your foot, guys, you have two nerves, medial and lateral plantar nerve. Everything is supplied by lateral plantar nerve except people supplying the hallux. Anyone has the word halluces, it is medial plantar nerve except the adductor hallucis. Remember the rule that we had in the upper limb? The adductor muscle, guys, is a deep muscle. So we consider it with the deep guys. So it's supplied by the deep branches of lateral plantar nerve. All right, so all guys in the foot supplied by lateral plantar nerve except people that carry the name halluces. And which is out of this rule is going to be the adductor hallucis. It's supplied by lateral plantar. It doesn't follow the rule of the medial plantar nerve. All right. Now, what's going to be the cutaneous innervation? Remember, guys, that we talked about the nerves that we have coming all the way from up to down. We had the femoral, and femoral nerve was giving you cutaneous branches. And then the femoral nerve, remember, when it gave us the saphenous nerve, and the saphenous nerve is a pure sensory that will take care of the medial aspect of your foot, this small area here by obturator nerve. And let's get back to this. That was femoral cutaneous branches. And of course, this is posterior cutaneous nerve of the thigh. Remember the SS pen. Of course, everyone knows about this. We talked about this in the hip region. And now let's get back to the leg and foot. Medial aspect of your leg is by the saphenous nerve that was coming from the femoral. And when we talk about, guys, in the posterior and lateral aspect, what we have is basically, remember that when forget about now this posterior cutaneous nerve of the thigh. Just remember with me what happens to the sciatic. As the sciatic comes down here, it was giving you the tibial, remember, and it was giving you the common fibular, and the common fibular ran for some period of time, and then it gave you superficial fibular, and it gave you anterior fibular or deep fibular. Deep fibular, not anterior. Okay, so what's gonna happen is we have here a story between the tibial and the common fibular. So the tibial will give you here something called medial sural. So the red, guys, this red color is going to be the sensory innervation of the medial sural, because tibial nerve runs medially in the sural area. Sural means the cuff area. So in this cuff area, which is brown, and the red, it's going to be the cuff area, which is the sural area. Medial sural from tibial, lateral sural from common fibular. And remember, when the common fibular finished here, it gives you superficial fibular and it gives you deep fibular. Deep fibular is going to disappear. It's going to be giving muscular innervation anteriorly. It will only appear in the cleft between the first and second toes. So the yellow place here is going to be by the deep fibular. So this is the only appearance for the deep fibular nerve. All right? Now, what about the brown? This is lateral sural. Lateral sural from who? From the common fibular. So remember, that was the sciatic. It gave me common fibular, remember? And that was tibial. So the tibial, as you trace it, it will give you here medial sural. So medial sural nerve will give you the red supply. And then the common fibular will give you lateral sural. So this is the sensation over this area, which is the upper lateral aspect of your leg. And then what about this grayish area? This grayish is actually superficial fibular. This is superficial fibular. This superficial fibular is going to give you the muscles, fibularis longus and brevis, and it's going to give you sensation over this area, which is what? Which is the anterolateral aspect of your leg. What do we call this? We call it a cutaneous branch of superficial fibular. That's it. This is a cutaneous branch of superficial fibular. This is only, no, not this is only. It's going to give you even sensation in the dorsum of your foot. Dorsum of your foot is going to be also by the superficial fibular. All right? So again, medial aspect was the saphenous from the femoral. Lateral aspect, we have a story between the people coming from the sciatic. Tibial will give you medial sural. Common fibular will give you lateral sural, and the anterolateral aspect by cutaneous branches of superficial fibular and the dorsum of the foot. Now, what about the plantar of the foot? It's very easy. I have medial plantar nerve. I have lateral plantar nerve. Those guys are branches of tibial nerve. All right. And then, of course, the very medial aspect here, that was the continuation of saphenous. Okay. And this very lateral was continuation of lateral sural. Okay, so, and this is calcaneal branches. Okay, the green one is calcaneal branches. All right, so this is very simple and easy. And now this also should be easy. So you have medial sural from tibial, you have lateral sural from common fibular, and you have the superficial fibular part of this here, and the rest of the anterolateral aspect going all the way to the dorsum of the foot. except the cleft between the first and second toes. It's this guy who disappeared, and he was thinking of becoming a muscular, going only to the muscles on the frontal aspect, but he suddenly decided to give a sensation in the cleft between first and second toes. All right. So if you guys look at a picture of a cadaver, you can see that in the first layer, you have three muscles: flexor digitorum brevis in the center, abductor hallucis muscle, and abductor digiti minimi here. And then between the first and second layers, you have the blood vessels and nerves. So you can see the lateral plantar nerve and lateral plantar artery. The artery is outside. And here you have the medial plantar nerve and artery here. And then as you get to the second layer, remember it was two tendons, two muscles. The tendons, or the two types of tendons. Tendons of flexor digitorum longus, and then the muscles coming out of it, the lumbricals, and then the muscle that is inserted into it, which is the quadratus plantae, and then the last tendon, which is the flexor hallucis longus tendon. And then in the third layer, remember that we had adductor hallucis and two flexor brevis. Flexor digiti minimi brevis, flexor hallucis brevis, and one adductor with two heads, exactly like the hand, horizontal head and oblique head. And then I want you to see that between the third and fourth layer, you can see the deep plantar arch, and you can see that one deep branch trying to come from the dorsalis pedis to complete the deep plantar arch from the lateral plantar artery. And then here you have the last layer, which has the interossei. You can see that the bipinnate is the dorsal interossei and the unipinnate is the plantar interossei. Just now I remember that I said palmar interossei in the previous slides. Sorry guys, we are here in the foot. We don't call it palmar, we call it plantar interossei. So these are the plantar interossei, and these are the dorsal interossei. So these are the two types of muscles, and then you have two tendons, the one that comes all the way lateral until it reaches the first metatarsal base of metatarsal, which is the fibularis longus tendon, and then the tibialis posterior tendon is deep down here. You cannot see it in this slide. And as you look from the dorsal aspect, here you guys can see the synovial sheets surrounding the tendons. We've already seen pictures of cartoon pictures, and this is how they are commonly wrapping around the digitorum and the fibularis tertius. And this is the extensor retinaculum, and here is how the tendons are going to the digits and to the hallux and to the base of the fifth, which is basically fibularis tertius. Another thing I have here is something that I didn't mention, which is the muscles that we have in the dorsum of the foot. It's going to be basically the extensor digitorum brevis and extensor hallucis brevis. So this is just basically small muscles with their tendons going to the phalanges. We call it extensor digitorum brevis, and a small muscle in the dorsum here going to the hallux is going to be extensor hallucis brevis. And these are the interossei if we were to see the deepest layer. So these are muscles between the bones. So this is going to be interossei. All right, guys. Now, coming to the clinical notes, we can have ankle sprain. And if you have ankle sprain, everyone understands now the three ligaments we have. Two between the talus and fibula, anterior and posterior talofibular, and one between the calcaneus and fibula. So we call it calcaneofibular. The most important tendon that can easily be torn during lateral sprain, remember, it's the anterior talofibular ligament. The anterior talofibular ligament in inversion kind of injury. If your foot goes into inversion, it will affect guys on the lateral aspect. Remember the idea of the injuries. All right, so lateral sprain can torn the talofibula, anterior talofibular. We have another thing called the Potts fracture. Potts fracture is a term used whenever we have a fracture in one of or two malleoli. It has 3 degrees. If I have a fracture in one malleolus, medial, let's say, it's a 1st degree, and then if I have a problem in both medial and lateral malleolus, it's a 2nd degree. If you have a problem in the fracture in the posterior of the tibia, it's going to be a 3rd degree kind of Potts fracture. We also have a clinical feature. It's what we call the pes cavis and pes planus. Pes in Latin means foot. Cavis means it has a cave, a claw foot, high arch. Planus means it's coming in the plantar aspect, flat foot. Okay, so these are just Latin terminology, which means flat foot and claw foot, and it's related to the arches of the foot. If you have a high arch, you have a problem with that. You don't get to see that in a scan, a foot scan. And now they have very nice ways of seeing, scanning the foot and preparing for a perfect orthotic to correct the problems with the arches, because it's going to be very painful because of the distribution of forces during walking is going to be affected. It's not going to be normal. So it puts a stress on the joints and muscles and tendons. All right, so that should be corrected. And so yeah, if you have a normal foot, or you can have a high arch, and also you can have a flat foot. With that, we are reaching the end of the last video of this module. Thank you guys for watching, and see you in the next modules.